If you can believe it's been 2 years, it was actually 2 years ago today that we were living with a lot of anxiety because we just heard about the first confirmed COVID-19 case on the First Coast. And then, of course, came the shutdowns and working from home and virtual school. Since then, more than 960,000 people have died from COVID, and people who took care of them are still working in our hospitals. Renata DiGregorio spoke with local nurses about this anniversary.
Hey, good morning, guys. Well, you've probably gone through every emotion when it comes to the pandemic right now, maybe agitation a little bit because here it is 2 years later, we're still having to talk about this. But this is an anniversary that nurses here in hospitals around town and most likely around the world really hope that you stop and think about.
I had days that I went home and I cried.
She's at the window going, "Don't leave me, don't leave me, don't leave me."
Emotionally and physically draining.
I saw him on March the 11th and they called me on March 12th and said, "You can't come back."
How do you sum up the past 2 years?
In the hospital, people used to get together and, used to hug and all that. Now people are kind of like more cautious about that.
I think it's okay to sit back and spend this time reflecting and acknowledging the sadness that you feel.
These two nurse managers at UF Health and Baptist Heart Hospital ran or still run the COVID units at their hospitals.
There was a lot of fear because it was completely unknown at that point. We were getting our very first COVID patient at Baptist downtown.
But on the 2-year anniversary of the world changing due to COVID, fear is not what they feel now.
I think the first feeling that comes to me is pride.
We are ready. We know what we're dealing with. We are ready. We know how to do it.
It's a sense of confidence that I might not have all the answers. I might not know what's coming, but I know that together that this team can do it.
So if you're wondering what's next, looking at the graph from the CDC, the average number of cases is actually lower than it was in last March, but it is still higher than it was in June of 2020. Renata DiGregorio, First Coast News, on your side.